Hi, I'm Dr. Rena Azar, and this is Dr. Brainwaves. I'm going to cover birth control methods today. We're going to talk a little bit about how effective they are and some general considerations regarding each one. I guess I like to say when I'm talking with women about birth control, I discuss with them that they should choose something they're comfortable with. They should choose something that they think they can adhere to. So be realistic about what your life habits are, and there's nothing wrong with saying, I can't do a pill every day, for example. And also there are some special considerations with each type of birth control that we will go over. So I'm going to go over first the very effective methods of birth control. We have very effective methods of birth control and not so much effective. And they generally run in the 99th percentile of being effective at preventing birth control for the very effective ones and about 80 percentile, so 20% chance of getting pregnant for the other ones, just as a generalization. I think everybody knows that abstinence is 100% effective. So abstinence is a great way to avoid not just pregnancy, but sexually transmitted diseases. I'd like to make one overall comment, which is that if you're using birth control, it doesn't guarantee that you're protected against sexually transmitted diseases. To be protected against sexually transmitted diseases, the best thing is always going to be condoms. And actually, you can use condoms with any other type of birth control. And one other little note to remember is that if you've had a tubal or you have an IUD and you get pregnant, you need to see a physician to make sure that you don't have an ectopic pregnancy. Please see my video on ectopic pregnancies because ectopic pregnancies can be life-threatening and you're at higher risk for an ectopic pregnancy if you've had your tubes tied or you have an IUD and you're one of the very few people that get pregnant with that method. So we'll dive in. Firstly, female sterilization or tubal sterilization. That is performed generally laparoscopically. It is a brief outpatient procedure. There are two main methods to do it, and then there's a third, it's postpartum, which we'll talk about in a minute. So when we go in laparoscopically to make people non-fertile, we used to kind of burn the tubes, but we don't do that. Our primary approach is going to be taking the whole tube out, and we do that because we used to think that a lot of these very aggressive malignancies came from the ovaries, but we now recognize that some very aggressive cancers come from the tubes. So if we're going to make people infertile and that patient's comfortable with the concept of it being irreversible, which most people are, then we're actually going to remove the tube in its entirety. That's not going to affect your hormones because that's not part of your ovary or your hormone production. We can also put clips on the tubes. If I had somebody who said to me, I am 99% sure and I would be willing to pay somebody to reattach my tubes through a very expensive surgery down the road, potentially, then I might consider putting some clips on the tube that just crimps the tube kind of midway. That's not going to be quite as effective as a regular traditional tubal, obviously, where we take out the tubes in their entirety, but it is nonetheless quite effective. And there's a postpartum tubal where we do an incision cut by the belly button because the uterus is very high, very tall after pregnancy. And we go in and we kind of shift the uterus over, we pull the tube out, and we take out a large portion of that tube. That also is considered pretty much irreversible. And tubals in general are considered over 99% effective. There's the male tubal, which is vasectomy, and there's a video on that, but the male tubal is also nearly 100% effective. I'm obviously targeting women in this discussion. So, the next thing that's kind of on our line because it's very, very effective is the Nexplanon. Well, actually, it's not Nexplanon, it's Implanon. Nexplanon is the older version. The newer version is Implanon. It is a subcutaneous implant. It is a little tiny, looks like a part of a Q-tip stick, very short, a couple centimeters. We stick it under the skin and the upper arm. And the nice thing about that is that you don't have to think about birth control for 3 years. It has some irregular bleeding associated with it. It will make periods less frequent about a third of the time. It will make periods stop about 20% of the time. About 25% of people might have some annoying, prolonged, or frequent bleeding. Those are the downsides of it. If you're not comfortable with an implant under your skin, that's not an ideal form of birth control. It is progesterone only, so for people who've got blood clot disorders, progesterones are more ideal than estrogens. If you have a known family history of blood clots, Your hematologist, your blood doctor, is likely to say it's fine to take a progesterone-based implant, although there are some better alternatives, which we will talk about. But not estrogen-related. Downside is every 3 years you have to have it taken out and replaced. Irregular bleeding can be associated with it. It is a progesterone, and some people will complain about bloating, headaches. It is easy to remove and reverse by just removing it if you don't like some side effects that you get. There's also a intrauterine device, and the intrauterine device is for somebody who has a blood clot disorder, is the ideal form of birth control that is reversible. In other words, obviously the most ideal would be getting your tubes tied or having the male partner get tubes tied. But when you have an IUD in, they are very, very effective, and they do not put a large amount of hormone into your system. There are 2 types of IUDs. There's the Paragard IUD, which is 10 years in duration, but it does not affect periods in a beneficial way. And then there are a variety of progesterone secreting IUDs like Mirena, Kyleena, Skyleena. And those IUDs are progesterone secreting. One major benefit of that is that they can be used for actually just bleeding control, not even birth control, because they usually stop periods in people. That's a kind of a nice side effect, unless you're one of those people that is not crazy about having your periods stop, because there are some people that like to have their periods, and for that reason they may not opt to get an IUD. So an IUD is a small T that goes into the uterus. We can do it in the office. If your doctor does that, they will usually give you some medication to soften the cervix and make it easier to insert that IUD. They'll also give you a little anti-inflammatory that can help with cramping the night of taking that medicine to soften the cervix and the morning of the procedure. We can also do it in the operating room. So the benefit of doing it in the operating room is that if we put an IUD in the office, we have to wait for the effect of that progesterone to thin the lining of the uterus out. That can take a while. It can take months, actually. If you have really bad periods, it might be a little bit enticing to do it in the OR, and this is why. We put you to sleep. We can look in the uterine cavity and be really sure it's a good fit for the IUD for one benefit, but also we empty the lining of the cavity out, stick that IUD in there, and it's generally effective at stopping periods immediately or very, very much slowing them down. So that's the IUD and its insertion. It's beneficial because the progesterone ones last 5 years, the Paragard lasts 10 years. And neither one of those puts a significant amount of hormone into your system. It's the ideal form of birth control that's reversible for somebody who has, for example, a blood clot disorder that they know about, where they are not allowed to take estrogens because they have an increased tendency to get blood clots. And those methods are all very close to 100% effective as well. I'm going to remind you, like I said earlier, if you happen to be really unfortunate and get pregnant while your IUD is in place, then you're a little increased risk for ectopic pregnancy, so get in and get checked out right away. I also want to comment that a lot of people will come to me and say, oh, I hear about IUDs that float all over the body and tunnel through your tissues and ends up in other areas, and they can actually migrate to other parts of the body, but this is how that works. The uterus has a muscular surrounding area outside of that canal where we put the IUD. Muscle is very dynamic, and muscle contracts like this when you're on your period. So if you put the IUD actually inserted into the muscle, you could actually have that IUD move as the muscle is contracting and moving around. If you put the IUD in the actual cavity, it's not going to have the ability to migrate aggressively into the body. I have seen occasional patients who have incredibly heavy periods and strong contractions of the uterus push an IUD out. That's really rare, and those patients generally will always see that. But IUDs don't generally just kind of go all over the body. I tell patients, I understand people's concern about that. Signs that you might be one of the few people that is at risk for that would be if the placement of the IUD is for you is incredibly uncomfortable. And that's likely to be from the IUD actually going into the muscular wall of the uterus, incredibly uncomfortable. And it's a very easy thing to investigate. So if somebody's really, really uncomfortable, then you simply send them to get an imaging study, an ultrasound, or really ideally a CT scan, and that will tell you exactly where that IUD is, and reassure your doctor and you that the IUD is in the proper position and it's not going to grow legs and crawl around the body. So that's the IUD. We also have other versions of birth control in the form of combinations, an estrogen and progesterone combination. So those are not ideal for people who have a risk for blood clots with estrogen presence, but those include birth control pills that have estrogen and progesterone. Those are daily pills. If you're not good at taking daily pills, not necessarily a great idea. On the other hand, there's a wide variety of birth control pills, so you can find something that suits your fancy pretty well in terms of how you feel on it. Birth control pills allow you to manipulate your periods, which is kind of nice, with a little coaching from your provider. Birth control pills are easy to discontinue. So those are some of the perks of birth control pills. We have estrogen progesterone pills, but we also have progesterone-only pills, and those are used primarily for people who have risk factors associated, once again, with estrogen, like blood clots. We kind of expand upon that a little bit with birth control pills. In other words, if you have, after a certain age, 35, if you have high blood pressure, if you have a certain type of migraine headache, if you have a history of clots, if you're a smoker, those are people that we say, oh, no more estrogen after that point in time, because there is an increased risk as you get older with those additional diseases in your body that put you at a high enough risk for a complication from the presence of estrogen. Then we say you can't consider those estrogen combination progesterone pills. But we do have a progesterone only pill, and it has the same benefits as the normal estrogen progesterone pill. The progesterone pill can be taken by people with those risk factors that I just mentioned. For blood clots, we're comfortable with the progesterone only pill. The downside of the progesterone only pill that I think people need to be aware of is that the progesterone only pill is a little picky-wicky. You got to take it pretty much the same time every day, or you're going to get some breakthrough bleeding and potentially compromise your effectiveness of your birth control. So that's a little bit of a difference that's important to know between a regular estrogen progesterone birth control pill and a progesterone only birth control pill. Also, we have estrogen progesterone combination birth controls available in a patch that you change out weekly, in a ring that you change out every month. You put it into the vaginal area. There's a ring that will actually last a whole year, and then there are rings that you replace every month. You put them in for 3 weeks, take them out for a week, and you'll have a period. So you have to be comfortable putting things in and out of your vagina. Those last few that I mentioned are all estrogen, progesterone combinations, but once again, quite effective in the 99th percentile plus. There's also another quite effective birth control method called the Depo Provera shot. The Depo Provera shot is given every 12 months. It's nice because you don't have to think about it in the interval time periods. Just think about it every 3 months. It is a shot if you don't like shots. It does stop periods frequently. It has the benefit of being something that decreases endometriosis, incidentally. And I want to go backward just a minute and mention that some of the IUDs do that as well. We'll talk about that in the endometriosis video. But I want people to be aware that with the Depo Provera shot, several things that might be problematic is that some people are at increased risk for worsening headaches, depression, or weight gain on that birth control method. And the unfortunate thing is, if you have that in your system, it will last 3 months. It is not easily reversible, so you're stuck with it for a while. I even give consideration to putting people on progesterone-only pills just to see if they tolerate those well. That's not like something that we've studied, but if I'm a little suspicious that somebody might not tolerate progesterone as well, I might try that before I stick them on a shot that's going to be in their system for 3 months. One final consideration with that is that some people get bone thinning. So after you've been on it for a couple of years, your provider will recommend that you get a bone density test. That is generally reversible, meaning if you stop it, if you're one of the people that gets bone thinning and you stop it, it's going to replace itself and your bone will replenish itself and come back and be normal. So now we're going to talk briefly about barrier methods. These are not very effective, usually in the range of 80% effective. So 2 people out of 10 will get pregnant in a year, roughly, using these methods. I think everybody's aware of condoms. Latex is the best. Plastic if you're allergic to latex. Animal skin ones, which is great to be natural, but they're not protective against STDs. Once again, latex condoms are the best protection against sexually transmitted diseases, and you can use them with other methods of birth control. And that's what you would ideally do if you have a new partner or a partner you're not sure about being monogamous. meaning one, that they also have one partner, which is you. Other forms of Berry methods is a diaphragm, which is a little ring you insert into the vagina, the cervical cap. Both of those need spermicide applied to them. And in addition to that, there's a female condom, which is a plastic tube-like apparatus that you put up into the vagina to help with barrier protection. There's a sponge that you can put into the vagina, which can last for 24 hours up in the vagina and give, it has its own spermicide in it. So it's a little convenient that way. There's the withdrawal method where you obviously withdraw during intercourse to pull the penis out before ejaculation. Not very effective. Once again, about 1 in 5 or 2 in 10 people will get pregnant in a year's time using that method. The rhythm method, which they say if you use it, if you're really meticulous about it and you have predictable cycles, then it's 90% effective. But in reality, I think we report 20 to 25% of people have failure with the rhythm method. Not a good idea if you don't have predictable periods and self-control. I like to mention that when you're considering birth control, do something your partner's comfortable with. And remember that you can reverse most all of these pretty easily. I think I have patients that are apprehensive that they're going to get, for example, the IUD in and that it has to last for 5 years. You have to leave it in for 5 years. And that's not true. We can pull it out anytime. And I tell people, if you're uncomfortable, you have a side effect you're not comfortable with, or you decide in 6 months you want to get pregnant, we will take it out. We're just trying to help you find, in the meantime, a good form of birth control that you're comfortable with and that works for you. And that's an overview of birth control methods. I hope you found that helpful, and thanks for visiting Dr. Brainwaves.